Assalamu alaikum and welcome to another edition of Ramadan Special EAVA FM 102.5. I'm your host, Dr. Shahid Latif, and again we've got a brilliant show today, and it's been a fantastic week, had some lovely weather, and I think we hopefully should have some better weather, though it's looking outside. It's a bit of a drizzle and grey outside, but you know what? The sunshine's come out because I've got two fantastic guests with me today who are going to be entertaining us with their knowledge. And when I say that, that's an understatement because both of them are very, very experienced individuals, very well known within the Midlands, very well connected doctors, and I'm really, really delighted to have them. Somebody said to me when I showed them that the two people who are coming in, said to me, you've got a star-studded guest list this time, and I said, absolutely fantastic, there's no doubt about that. So I'm going to introduce you to them, and then what I'll tell you is what they do and what we're going to be talking about. So let's, without much further ado, let's introduce our first guest. Our first guest is Mr. Shabi Ahmed. He's a consultant urologist, surgeon working in Birmingham, Sandwell and West Birmingham NHS Trust. So as I said, he's a surgeon by background, and he's also the president of an organization called Dugane, and he's there till 2020, and we'll ask him what Dugane is in a moment. Now, our second guest is no other than Dr. Amir Birni. Amir is a very well-known doctor within the Midlands, just like Shabi, and he's a doctor from Pakistan, graduated in Pakistan, but been here for over 20 years. Amir's background, he's done a master's in medical education, and also has a fellowship from the Royal College of Surgeons from Edinburgh, but he lives in Nottingham, and we have Shabi from Birmingham. Amir also has a master's degree in sports and exercise medicine. So we're going to be talking about that. So it's going to be quite diverse today. And last but not least, just to add, just like I mentioned, Shabi being the president of Dugane, I can announce that Dr. Amir Birni was elected as the president of the Association of Pakistani Physicians of Northern Europe, also known as APNE. A name which really makes a lot of sense and is close to the heart for a lot of doctors. So without much further ado, Assalamu alaikum and welcome both of you. It's you know what, it's a Sunday. Well, no, it's a bank holiday, but I always appreciate, you know, when people take out their time from family, from their busy work, and I know both of you are extremely busy men, and you do on calls, and you do, you know, you got family commitments, and I know you do a lot of community work, and we will come to that. And so I really appreciate for you both traveling, one from Nottingham, one from Birmingham on a Sunday morning, not easy, fasting, you know, looking after family.
Well, it was a pleasure to drive through the countryside of Leicester because my sat nav just got me through the ecological route.
Okay,
and it was a beautiful landscape to come across. I must say I've never driven through this area before. All I used to do was travel through the motorways, so it was a beautiful morning.
Fantastic. So you've discovered something different this time as well.
I saw some posh neighborhoods of the Leicestershire County.
And Ahmed, did you get the same experience coming from Nottingham?
Well, not really. I came off the M1 straight off the actually, but thank you for having us, and thank you, Shahid, and thank you, Radio Ramadan FM. Really gives us a platform to not just to talk, but engage with the wider community out there.
Absolutely.
And
yes.
I think it's a wonderful opportunity to talk to people, and those who are listening in will obviously have some questions for us.
Excellent.
So thank you for having us.
Excellent. So listeners have various ways of contacting and connecting with us, as most of them know already. We're on Facebook on Ramadan FM. We live stream, so you can see the two very good-looking men over here who are who will be part of the discussion today. So Ramadan FM it is. So you can actually go on there and send us a comment or any questions or anything you want to say about the show. So please do that. The alternative is you can tune into 102.5 FM. You can call us on 0116 212 9324 or text us on 07450 925084. I will be repeating these throughout the program. But please do join in, please do connect, please do listen, because we're going to have invaluable information, and we're going to be educated by two very senior and very experts in their areas. And please call in as well. And so any comments or any questions, please do that. We've got a lot to cover today. And so what we're going to do is we're going to open up the floor. Let's start off by asking Amir and then Shabi exactly what they do. because it's diverse. It's very simplistic to say. I know some of the things that we're going to be talking about, Amir, something is but the community work, what doctors do and what you do, and some of the work that you're involved in, like Creative Minds, Apne as an organization. And we're going to ask Shabi as well, because Shabi is very much not only active as a doctor, he's also as a consultant. He's also involved in community work with Dogane, which we'll ask him about, and also with Apne as well. So I think it's going to be very interactive. And along with that, we are going to be talking, and Shabi will give his expert view on issues related to the kidney and Ramadan, stones, etc., and dehydration and all that. Right. So let's open up the floor. Amir, and please, Shabi, please feel to chip in as well. Medical work, community work for doctors. What does that mean? How do doctors get time to do that?
Yes, it's a very difficult question to really answer to. I think sometimes you just fall into community work given the profession we do. And I think medicine is not just a science, it's a social science. It's probably unique that you work with the science and you work with humans and you bring them together. So I think it's just a natural progression of any medic. The tendency is always there to help communities, help your patients as a community. And if you find the time, sometimes the doors will or find you, or you might find the door as well. So the opportunities are out there. But you're right, we live a very busy life as medics, but that really should not stop us, because there's always time for doing some community work. It's just identifying that time.
Absolutely, very well said, Amir. Thank you for that. So what kind of work? Because I know you do medical you've got a master's in medical education. So what does that mean for? I mean, what I really want to do is, I really want to. There's a lot of youngsters out there listening, and not just now, not always going to be live, but also this live stream will continue. So a lot of people will be listening. So what does medical education actually mean?
Well, for me, obviously, I trained as a medic, I trained in Pakistan, came and worked. But I was always into teaching and training and helping people, helping my junior doctors or helping students to learn and whatnot. And we were taught by some great physicians and surgeons, both in Pakistan and here. So you observe those people and you say, all right, I need to learn that skill as well. And medical education came literally to me, was asking a simple question. One of the hospitals I was working, saying, how do medical schools run in this country? And I would like to be part of a team running a medical school. At some point, learn how schools are run. And before you know it, 10, 12 years later, I'm now working as a co-director for studies for Sheffield Medical School, and also the academic lead for clinical skills. But they're just job titles, really. But the underlying passion is to really help or really teach or really train the next generation of doctors. So for me, per se, medical education became a means to transfer information, transfer skills, knowledge to the next generation. And anybody can do it, really. If I always say to my students, if I can be a doctor, be a surgeon, do a medical education, it's literally anybody can do it. It's just, just finding a path. So medical education for me means at the moment, obviously, managing medical education in School of Medicine, Sheffield, but also mentoring, also looking after students, supporting them.
I'm going to actually hold you on that one, Amir, because mentoring, you've just used a word, and I'm going to actually come back to you and talk to you, because that's really, really important, because that's what I wanted to ask you about. So mentoring is something I'm going to ask you about. I'm going to ask you about the community work that you do and how people can get involved, because it's very similar to the kind of work that you do, that we do here in Leicester. And last but not least, we will ask you about Apne, because as we said that before we do that, I'm going to ask Shabi. Shabi, you're a president of Dugane.
Yes.
I asked you to send me your resume, and one of them you mentioned that you're the president of Dugane till 2020. What is Dugane?
Dugane is the Medical Alumni Association for doctors who have graduated from Dow Medical College, Karachi. And at present, it is the biggest overseas alumni medical group among all South Asian doctors in the United Kingdom. There are about more than 3,000 graduates from Dow Medical College from the 1960s to the recent times who are working in the NHS. And by far, this organization has been running for the last 15 years and can surely be said to be one of the oldest alumni organization. So I'm honored to be the president of it, took over the reins last year and will continue for another year. And the purpose of the organization is not only social but educational, charity. We are a registered charity in the United Kingdom, and we have provided charity worth millions so far. Every year we take up a project back home, and we support them, and we take charge of it in a way and help build it forward. So this is one of the aspects of the organization, and of course, we continue with supporting our fellow colleagues from Pakistan and from other places in their career objectives, in their educational needs.
And if anybody wants to get more information about Dogane, do they have a website?
Yes, there is a website available. It is www.dogane.co.uk, as well as we've got a Facebook page. So by all means, get in touch with us, and we'll be more than happy to assist all Pakistani doctors in their career objectives and help them find their ways.
Fantastic. Thank you, Shabi. Thank you for that information. And like Shabi has said, there's a number of organizations, alumni, Pakistani Medical College alumni, Dogane being one of the oldest ones. So this is absolutely fantastic. But I'm going to talk about something very similar, and I'm going to talk to Amir about Apne. So Amir, so you are the Apne's first president. For our listeners, because I know there'll be a lot of doctors out there listening as well. So before we come to the medical conditions, let's talk about Apne, because obviously this is a medical show. And tell us, Amir, what is Apne? What's the thought behind it? And what do they do? Being the first president, what are you going to do?
All right, lots of questions. Let's see how many answers I can get to. But Apne, as the name says, is an association of Pakistani physicians of Northern Europe. But the wordplay is brilliant because you translate this into Urdu and it sounds Apne as in our people. The concept of Apne was always there. Some of our seniors, Shahid Qureshi, Dr. Shahid Qureshi, and many others, Iftikhar Yusuf, and many, many more, they were always thinking about getting a platform which will unite all alumni from Pakistan, and also maybe include the British graduates who studied here and graduated from the UK schools and European schools. So the idea was to provide a singular platform to medics, whether they're from Pakistan or they're second generation or third generation British graduates, and to come together, really, regardless of which school you came from. And with numbers comes power, and the power is in the college of politics or social sciences or education or training. There's immense potential out there. So the idea really culminated into a form of a steering group about a year and a half ago, which Shabi was also part of, and there were many others who really worked. And really, we must admit to the supreme guidance of Mr. Amirullah Khan, who was the president of the chairman of the steering group at the time, and then it was Amir Ayub, Ayaz Abbasi, many names, as we say, Umar Daraz Khan, and so many others. So without naming everybody in the steering group, we delivered what we sought out a year and a half ago, and we launched the organization last year. We launched a membership, which is a paid membership, and we are now nearly 300 people strong on it. And really, the biggest thing we were looking to do was to do an election, because we believed it should be a democratic organization, and everybody should have an equal chance of representing or being part of the executive body. And the elections were run as of last year, and run by the UK Reform Society, completely independent UK body, and announced the results. And we were I was lucky enough, or blessed enough, or privileged enough to be the president of the organization for 2 years, and we have a 15-body executive. So it's come together. The oath was in February, as you know, you were there, Shahid, weren't you? And you also remember, as well as Shabi. And we are now about 4 months since the oath-taking ceremony, and we just started. So we are an evolving body. Every day is a new day for us, and we are looking down the academic route, the medical education route, the training, the teaching route, supporting networks, formation of networks route. So there are many platforms within a big singular united platform.
Fantastic. Thank you for that comprehensive response. What we're going to do now is we are going to go on to more medical matters, and we will be discussing things in relation to Shabi's background, and also Amir, we're going for yourself as well, because you do have a master's in sports medicine, and I think our listeners out there may have a number of questions, but it depends on what we throw towards them and what actually is meant by sports medicine. But before we do that, Shabi, I would like to ask you, you're a consultant neurologist. Area of expertise are all the parts of the waterworks.
I'm the human plumber, as we call it.
Plumber, nice way to put it. So tell us, what does a urologist do?
A urologist is the person who looks after the urogenital tract of the human beings. So in common words, looks after your kidneys, your waterworks, your bladders, your prostate, which is an ongoing issue, and lots of men are interested and concerned regarding the health of their prostates and the risk of prostate cancer, which is uh, a very topical story in the media, and lots of people are concerned about it. But most importantly, my area of expertise and training is stone diseases. Now, most importantly, the Muslim population, which we all belong to from the Southeast Asia, fall into what is called as a stone trap. A stone trap is a geographical area which from the west starts from Turkey, north of Turkey, comprises the whole of Iraq, Iran, Afghanistan, parts of Central Asia, and India and Pakistan. And in this part of the country, of the geography, the stone in the human body or in any person is about 3 times more than what you will fall in the Caucasian population or in the Far Eastern population. So our communities are unfortunately quite adversely affected with it. Now, I work in West Birmingham, which has got a huge South Asian population, immigrant population, and the number of stone burdens that we come across is by no means different from what I would be seeing if I would have been practicing back home. So these sort of people need to be helped. They need to be investigated. They need to be investigated early, managed properly. If not, there is a high risk that these people can even lose their kidneys, and they can even go into renal failures.
These are really important points, Shabi, and I would really urge our listeners to call in if they have any questions on 0116 212 9324 or text us on 07450 925084 on Ramadan special EAVA FM on 102.5 FM, or join us on Facebook on our group page, which is Ramadan FM. So Shabi, obviously there are different types of stones, and one size doesn't fit all.
That's correct, yes.
And individuals have stones. You don't always give the same advice to the same people, do you?
No, see, when we treat any patients, there are patient factors that are taken into account. Then, of course, if they have stones, then we have to take the stone factors into account. That is the size of the stones, the symptoms of the patient, the composition of the stones, because all different stones have different treatments, and they come from simple surveillance. Some small stones which are non-obstructing and not causing any problems can just be observed, whereas acutely obstructive stones, especially the stones which drop out of the kidneys and block the kidneys, can become a life-threatening emergency if the kidney becomes infected. And I have unfortunately seen people in their young age, 20s and 30s, dying because of obstructed kidneys. And this, again, I would re-emphasize the point that if somebody has got severe acute pain, which is suspected of a stone, and along with that they have got high fever and feeling unwell, which in medical terms we called as blocked septic infected kidneys, they need to be seen ASAP. Otherwise, there is a very, very high risk of.
I'm just conscious we've got about over 1.5 minutes. But what's really important, Shabi, before we go on a break, is can you just tell our listeners? I mean, you've mentioned a severe round of stones, fever, severe pain. What kind of symptoms are there where you can pick them up earlier?
The common things which bring stones into light is non-specific abdominal pain. That this patient might having an ache and discomfort for weeks and months.
So abdominal pain, basically,
yes.
Pain in the tummy, yes?
And the other features would be blood in the urine.
Okay.
Recurrent infections in the urine, especially in female population. They can have stones. And then issues some of the stones just come to light incidentally, that people have a scan for some other reason or an x-ray for other reasons, and stones are picked up. So do not ignore symptoms. If you are having any pain in the abdomen and you don't know what's going on, seek medical attention. Likewise, do not ignore blood in the urine. Every 2 out of the 3 people who have blood in the urine have got a significant pathology. It might be cancerous or non-cancerous. So especially my message for the Asian population is, and especially for our women, that we tend to neglect ourselves, we tend to ignore our symptoms. Please do not do that.
Okay, Shabi, that's really important, and we will come back because that's such an important area. So we're on Ramadan special, EVA FM 102.5 FM. We have got Dr. Amir Birni and we've got Dr. Shabi Ahmed, and we're talking about urological problems, the waterworks, but we'll be touching on other areas like sports medicine. We're going for a quick break. See you shortly on the other side.
Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters, I just want to say a big jazakallahu khairah for all of you that have donated to help me build this city retreat here in Leicester. Alhamdulillah. With your help, we have almost finished off the building work. We've completed 2 prayer halls, wudu areas, 2 offices, a kitchen area, a basement area, subhanallah. And we've delivered many amazing services with your donations to boot. For example, we've helped countless homeless people through our night shelter on the coldest days of winter for the past 3 years, as well as hosting thousands of individuals to pray Jummah and their daily prayers. Many have taken Shahada here, and they've been looked after in our weekly study circles and new Muslim support programs. Hundreds of youth have been empowered each month, and exhibitions about this beautiful faith have been held. Alhamdulillah. This Ramadan, you can gain an amazing reward by helping us to finish off our final building works and create a garden and a cafe for our guests. We just need £27,000 more to finish off all of our work. Let's seek the night of power in these final 10 days of Ramadan by doing acts of worship for Allah subhanahu wa ta'ala. This can be better than 83 years of ibadah. One way to gain this is to pay your sadaqah to support others to learn about the faith of Islam. The Prophet ﷺ said, Allah rewards the deeds of a believer in this month from 10 to 700 times. But for the fasting person, Allah subhanahu wa ta'ala rewards that deed directly, subhanallah. Find Laylatul Qadr, get rewarded for your fasting directly to Allah subhanahu wa ta'ala, up to 700 times reward and manifold increase. What are you waiting for? Hit that donation button right now and share this video. Jazakumullahu khairan. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters, I just want to say a big jazakumullahu khairan for all of you that have donated to help me build this city retreat here in Leicester. Alhamdulillah. With your help, we have almost finished off the building work. We've completed 2 prayer halls, wudu areas, 2 offices, a kitchen area, a basement area, subhanallah. And we've delivered many amazing services with your donations to boot. For example, we've helped countless homeless people through our night shelter on the coldest days of winter for the past 3 years, as well as hosting thousands of individuals to pray Jummah and their daily prayers. Many have taken Shahada here, and they've been looked after in our weekly study circles and new Muslim support programs. Hundreds of youth have been empowered each month, and exhibitions about this beautiful faith have been held. Alhamdulillah. This Ramadan, you can gain an amazing reward by helping us to finish off our final building works and create a garden and a cafe for our guests. We just need £27,000 more to finish off all of our work. Let's seek the night of power in these final 10 days of Ramadan by doing acts of worship for Allah subhanahu wa ta'ala. This can be better than 83 years of ibadah. One way to gain this is to pay your sadaqah to support others to learn about the faith of Islam. The Prophet ﷺ said, Allah rewards the deeds of a believer in this month from 10 to 700 times. But for the fasting person, Allah subhanahu wa ta'ala rewards that deed directly, subhanallah. Find Laylatul Qadr, get rewarded for your fasting directly to Allah subhanahu wa ta'ala, up to 700 times reward and manifold increase. What are you waiting for? Hit that donation button right now and share this video. Jazakumullahu khairan. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters, I just want to say a big jazakallahu khair for all of you that have donated to help me build this city retreat here in Leicester. Alhamdulillah. With your help, we have almost finished off the building work. We've completed 2 prayer halls, wudu areas, 2 offices, a kitchen area, a basement area, subhanallah. And we've delivered many amazing services with your donations to boot. For example, we've helped countless homeless people through our night shelter on the coldest days of winter for the past 3 years, as well as hosting thousands of individuals to pray Jummah and their daily prayers. Many have taken Shahada here, and they've been looked after in our weekly study circles and new Muslim support programs. Hundreds of youth have been empowered each month, and exhibitions about this beautiful faith have been held. Alhamdulillah. This Ramadan, you can gain an amazing reward by helping us to finish off our final building works and create a garden and a cafe for our guests. We just need £27,000 more to finish off all of our...
Assalamu alaikum and welcome back to Ramadan Special, EAVA FM 102.5. I'm your host, Dr. Shahid Latif. Right, I'm going to go straight back in because we've got a lot to talk about. We've got Dr. Shabi Ahmed, who has been talking about stones and kidneys and problems and symptoms, and we got Dr. Amir Birni, who we will be coming to in a moment and talking about some really important issues in relation to community work, in relation to sports medicine, in relation to mentoring, etc. for our youngsters. Shabi, just before we go and move on, just a completion of what we were talking about just before the break. We were talking about symptoms and mild symptoms and the importance of the people out there not to delay, especially if we have blood in the urine and people tend to ignore it. There could be sinister reasons and there could be non-sinister, but still needs to be examined. So
Absolutely.
once they've gone, right, I think we've got a caller. So if we just put our headphones on. Assalamu alaikum.
Wa alaikum salam.
Who have we got on the line?
I don't know whether to disclose my name or just keep it like that.
That's
but
fine.
I was going through your program and it appears you today addressing or maybe looking at the urology side. I suffer from enlarged prostate.
Yes.
And I'm taking tamsulosin and I'm also taking finasteride.
Right.
I had a blood samples taken, and it appears that the GP may not be in a position to make a referral because
Okay.
the BHP or whatever is at a reasonable level. You see.
So PSA blood test is a marker for or a indicator for screening for prostate cancers. But if you have got an enlarged prostate, and mind you, 8 out of 10 prostates in men which are enlarged are not cancerous. But
Right, okay.
it is a marker that the prostate can be enlarged and can have significant symptoms in terms of quality of life, in terms of your day-to-day habits and symptoms. So if you are on the dual therapy, which is what we call it as medical therapy for management of benign enlarged prostates, and if you are stable and your symptoms are settled and you don't have any much difficulty with your quality of life with the medications, then that's fine. But failing which, if the medical therapy is not working and if your symptoms are not getting any better, then there are
That's
very...
where I was that the urine flow is very, very low, and if I'm a bit late to go into the toilet because I'm out and about,
Yep.
it becomes very difficult to pass urine as
If-
well. So,
I think in this situation it depends upon how long have you been on medical therapy. However, it seems that medical therapy is not being very effective for you, and
Right.
surgical options might need to be considered.
right.
So my personal suggestion would be to seek the attention of the urologist in your local area, or ask your GP to refer you to the local urologist to seek surgical guidance regarding management of your benign enlarged prostate.
Right, because I've been on the care with the hospital as well. I've been there several times.
Right.
But because it was manageable, but I think lately it appears that going for, with the waterworks are not as good as they used to be. So I suffer pain because of the difficult to release water and things of that. And that's the reason I thought I'd check, because it seems the GP may not be in a position to make a referral.
If you're already under the hospital, then all
Yeah.
your GP needs to do is send a letter to whoever you're under with a follow-up note that your symptoms are getting worse and that you need
Yeah.
to be seen again to explore the options of surgical treatment. Now, I'm sure whichever urologist is looking after you would be able to get you back in their clinics to assess you and offer you the appropriate treatment.
Right. Okay. And do you think Leicester has got the capabilities of?
Leicester is a very good urology center, and I would highly recommend that you do seek advice from your local urologist.
Okay, fine. Thank you.
Thank you very much to the person who's written a very, very crucial question there. So the person who's rang in, thank you very much for that. I would say, just as a disclaimer, just make sure that any advice that's given on the show is a generic and like Dr. Shabi has rightly said, I think the best person, though we can provide you with advice, but it's important to get in contact with your GP and take things from there. But any information that you require, we do have experts, and they will give their views and opinions. But this will be specifically would be to get in contact with your GP and not do anything without professional input who you are linked with. So Shabi, thank you. So you were saying?
Yes, so we were talking about stone diseases, and in this day and age, the treatment for stone diseases is very much highly advanced. You've got very effective, strong shock wave lithotripsy devices, which is a minimally invasive procedure done under local anesthesia, and is very effective in dealing with small, non-obstructing stones in the kidneys. And again, I'm sorry to use some medical jargon here, but non-obstructing stones are stones in the kidney which are not causing any blockage to the flow of the kidney, urine out of the kidney. Then if in case the shock wave lithotripsy treatments are not effective, then we have got minimally invasive treatments, that we have got special endoscopes that go through the ureter into the kidney, and with very effective strong laser devices we can fragment the stones and deal with them. Now again, 80% of all these minimally invasive ureteroscopic procedures are pretty much day case procedures. And gone are the days when people used to have open surgery for stone diseases, in which they used to stay in the hospital for 5 days a week or something like that. But this is not the case anymore. And even for larger stones, we can do percutaneous stone removal, and that also is not more than a night stay in the hospital.
Fantastic. Thank you very much, Dr. Shabi, for that. I think we've got a question which has come up. First of all, thank you to Dr. Imran Musa, who has joined. And we've also got a question from Fasi Khan. Right, the question is, my question to the guest, please. I appreciate that doctors from certain parts of the world have common challenges and often feed off one another for support. Having said that, all of that, there are now organizations within the UK, example BEMA, who are more inclusive and can provide similar services, that is, branches within. Why do we need so many groups? Isn't this promoting nationalism indirectly? Shouldn't we be uniting under a larger, more inclusive group? Yes, a very good question. Amir, would you want to respond to that?
Yeah, that's an excellent question. And yes, you cannot take away anything from the existing organizations like BEMA, because actually I'm a member of BEMA and work very closely with them.
Okay, I'm just going to hold you there, Amir. We've got another caller on the line. We will come back to that. So hold your BEMA thoughts for the moment,
I will.
and we will respond to Fasi's question. Assalamu alaikum and welcome to Ramadan's FM. Who do we have and what question do you have?
Hello, Assalamu alaikum. And I'm Dr. Kamla Haider speaking, and congratulations to you, Dr. Shahid, and your team of two very renowned doctors today, Dr. Shabi and Dr. Amir Perni, today on board. It's a beautiful show that you're doing, and it's very informative as well.
Thank you very much, Dr. Kamla, and I'm sure Dr. Shabi and Dr. Amir would reciprocate that, because you've been on the show yourself and you've done a fantastic job and got a very good response. So
thank you so much.
So thank you very much for calling in, and please keep listening.
My question to Dr. Shabi would be, like, there's a lot of on social media, there are a lot of talks about fizzy drinks at the time of opening the fast. So if you can just pass through what could be the hazards to the kidney, because they say that the kidneys can be affected.
Yes,
So a lot of patients ask us, and even family and friends around us, as medics, they ask what could be the hazard. So if you can just
that's a very good question, especially with the view of the holy month of Ramadan and the fasting things. All these carbonated drinks have got high pH values. These are all acidic drinks. And by far, all the chemical milieu of these drinks are quite harmful for the nephrons or the structural units of the kidneys. They can damage them. And especially in an environment that you're opening your fast after 18 hours and your kidneys are already dry and dehydrated. And if this sort of environment is placed on the kidneys with the acidic amount of fluids going in, these damage the structural units of the kidneys, and therefore there has been a lot of talk and lots of research and guidance provided that they should be avoided. So all these fizzy pop drinks, soda pops, Coca-Colas, etc. Should preferably be avoided. Now we can only give guidance. There is no absolute rule in these things, but common sense would guide that if one avoids that, then that's a preferable way forward.
I think that was a very concise and a very a good answer. I think I've got a voice now in front of my family and friends and patients if they ask me. The other question to Dr. Bernie would be, like, he's spoken about apnea and he's looking after apnea for 2 years. He's a president. He's doing a good job. Just wanted to ask, like, what is the voice of, like, doctors, the members on this platform? How are we going to take this forward?
Right, thank you, Dr. Heather, for that question. Now, obviously, as you said earlier, we are a young organization. We have reaching about 300 paid membership. And we are very inclusive in terms of we're not just taking on board people who are coming from various alumni colleges, schools from Pakistan, but also hopefully British graduates who are second or third generation or are studying here. And although it says MedX, but we have an affiliate membership as well. So hopefully in future we will have many people joining us. But because as I said earlier, the word democratic means a lot to us. And when we say the word democratic, that means everybody has a voice, and everybody should be raising their voice, should be passing on their comments, critiques, and literally if they have anything they have to say to the organization, they should be saying it. So every member will have a voice. Every member, hopefully, the comments, the critiques will be listened to, and hopefully actioned upon. So the idea really was, as I said earlier, was to try and first get people on a singular platform, which obviously is a difficult one to do because we all come from varied backgrounds and we have our own agendas or all our works or our professional lives. But the idea is to find some commonality amongst these many diverse populations of some fantastic doctors who are doing some really great work, some medical students, when you listen to them, what they do. But there will be some commonality, and the idea is to give membership a voice. So we are a one community, one voice. That's our slogan. You can visit our website. You can see what we stand for, and hopefully that will give you some insight into the organization. And hopefully many others who are listening and will also have a look at our website and maybe join us in future.
I think that's a wonderful platform, because if you get all the diverse people with one voice and one common interest on one platform, which is a difficult task, I can see that, but I think you're doing it very well. Thank you for your answers, and Dr. Shahid, you're doing a lovely job, and congratulations to Ramzan Radio as well. Thank you.
Thank you, Kamala, and thank you very much for the lovely compliments and for phoning in. You take care. Look after yourself.
Thank you. You take care.
Thank
Allah
you.
Hafiz.
Allah Hafiz. Amir, we were talking about earlier on, I think we can take our headphones off. We were talking about the question that we received from a very crucial question from one of our listeners about BEMA and why do we need more other organizations. So you were responding to that.
Yes, and as I said, there are some really successful organizations who are doing some really great work, and I'm already involved with BEMA and many other organizations. But the idea was to provide a singular platform, and this was a platform from all alumni from Pakistan, the schools who are existing, the colleges. And as Shabir said earlier, Dow Medical College has got a massive platform of more than 3,000 doctors in this country registered working. But then there's Rawalpindi Medical School, there's many others. And we work in this country, we raise families, we become extremely successful professionals. But we should come together. And by coming together, not just to share experience or expertise, but also hopefully become a political voice. And the numbers will increase, the voice will become louder. And it's not just about training, teaching, it's also about supporting and networking, as we said earlier, mentoring, and offering something to the next generation. So having all that experience in the UK, Europe, or Ireland, for example, what's the point if they cannot help the next generation? So I firmly believe, one, that it was a democratic organization. Secondly, it brings people of diverse backgrounds, from clinicians, from urologists to psychiatrists to sports to surgeons. And it provides a platform, hopefully not for us only, but also for the next generation.
And just that nicely takes me on to my next question, Amir. Tell us a little about the community element. Please put into that the kind of work that you're doing. Being a president, and obviously you're in president for a couple of years, but obviously you will still, once you're not the president, you still be a part of APNE. So what kind of community work do you think that you would like to set out as a president, but not only as a president, but as an ordinary member or an executive member of APNE, or if you take yourself out of APNE, kind of community work? I mean, what are you involved in, and what would you encourage others to be involved in?
Well, first and foremost, we are part of the British Asian diaspora, and I'm as like you are, or anybody out there, we are members of this community. We own this community. We own this country. We have been in this country forever, for a very long time. And now, really, it's time to give back. Really, isn't it? It's about social accountability. It's about giving back something to the community. And again, we come to this stage or age where we think we can give something back. And as somebody else was saying earlier, I think Zed was saying it earlier, there's no age where you can start thinking of giving back. You can start at 20 or 18 or 15 or 45 or 60. But to have that spark where you think, all right, it's for me, I think it's time for me to give something back to the community. Now you can do it individually, or you can do it with a group or with an organization. Being in an organization, as Fasi said earlier, there are many, but organizations give you strength. It gives you the numbers, it gives you the expertise, the experience in one room. And let's have BEMA, for example, or many others, BAPU is there. You work with them in tandem. So you're not competing with each other, you're actually working. We might have separate agendas, but there will be some commonality of work. So things like, visas, immigrations, mental health, stress, healthy well-being. So many common strands which will exist. We'll have our differences, but I think that's the beauty of organizational work. You will have differences, but you come together, you work together. So the community work which we do is diverse. Again, is from on an individual level. Many I don't tend to mention it because I consider these are charity works and they sort of kept private. But now that you ask a question, yes, we work with communities in Nottingham, for example, and it's all about integration, bringing communities together. We had an event. I think you came to one of our events last year as well. Was to bring Indians and Pakistanis and English people together and do a Pakistani event with everybody dressed in Pakistani clothes, including the English and the English people as well, and have Pakistani food and listen to Pakistani music, which they had no idea what they were singing, but they enjoyed it.
Fusion, as you called it.
It's fusion, is it? It's fusion of cultures, and some melting pot of cultures we live in. APNE, as an organization, will hopefully also have a social stream as well. And we have a social secretary who will look after things, and we will try and bring people together on many platforms, not just medical platforms, or academic platforms, but maybe on a social platform. Do something for the community as an organization.
So, what kind of work are you? I understand you've got an organization or you are part of an organization called Creative Minds. Yes, what is that?
Well, yes, now that you've heard of it. So Creative Minds Society is an organization which was established in 2004 by a poet, a very well-renowned poet in Nottingham, Mrs. Farzana Khan, and some of our friends. And then recently, because we had interest in art and literature and some other art forms, we sort of met and we exchanged some ideas and you sort of came together, and we became part of the Creative Minds Society. And the Creative Minds Society is something which is existing in Nottingham. Hopefully it'll spread outside of the Midlands as well in the near future. But the idea is to bring people through promotion of art and food and music and literature and prose.
Fantastic. That sounds absolutely wonderful. Here we are, listeners. We've got a doctor, a very active doctor, who's very busy in his work, and he's doing a lot of community work, and he's engaging the public on the community locally to get involved in other. And I think that's really, really important. I can say that as a psychiatrist, that it's really important that when you are doing a certain part of work, it's important to diversify yourself. That's really important. And Amar, you were going to say something about
I was just going to say, because, another example of both the Creative Minds Society that recently, along with Radio Fazar, and really must thank Radio Fazar because they've joined our team and they led a massive project only about 3 weeks ago, just before Ramadan started, was to do a talent show in Midlands. And I don't think anybody's done it yet. We had 46 participants participants across 12 categories, and kids came and performed, and the whole idea was to give the kids a platform, and they came from English backgrounds, Indian, Pakistanis, there's Hindus, Christians, and people of faith and no faith, and the idea was to give this platform, and it was so lovely to see young people performing and winning, and people voting, and it's just brilliant. So that's another example of how people can come together to promotion of food and art and literature.
So maybe this is an opportunity to get you involved in Leicester then, because it's very similar kind of work that organizations like Teams are doing. It's basically helping and motivating youngsters to basically get involved and have a platform. I think we've got another caller on the line. Assalamu alaikum.
Assalamu alaikum, Dr. Shai.
Wa alaikum salam. And who do we have?
My name is Dr. Habib Haider. I'm a physician in terms of local hospital, in terms of stroke medicine.
Fantastic. Thank you, Dr. Habib, for calling in and taking out your time and listening to us. And what, do you have a question or a comment?
I think you guys doing an excellent job. It is a really good job in terms of all the community work. And today you have a very excellent presenter, Dr. Shabi and Dr. Amir Barni. So I have a question for Amir Barni regarding this. Assalamu alaikum, Dr. Barni.
Wa alaikum assalam.
So I have a question for you regarding this community work that you explained something which is really good for in terms of doctors and other healthcare professionals. So are you planning to do some type of like community workshop in the different areas, basically for the doctors and the other health alumni?
I think that's an excellent question, really, and obviously you might have heard of the workshop we did in Nottingham recently under the banner of UPNE, which was just talking about stress. We actually called it "Let's Talk About Stress," and Dr. Heather was there also presenting. Kamla Heather and Shahid Lateef very kindly came from Leicester to present. And you were there, I think, one of the audience members. And if you remember, we had medical students in there, people who weren't medics, a pharmacist, and some junior doctors, some senior doctors. And the idea was just to get into a room and just to talk about stress, really. It wasn't medical jargon filled. It was just how do you deal with stress? What is stress? So what might be stress to me might not be stress to the next person. And we live in stressful times. So that is something I was saying earlier. There are many themes which might be common across all organizations, who does not feel stressed out. So all organizations can work together and maybe help, with mental health or well-being or stress or dealing with stress, for example. So yes, there are some workshops planned. We have an education committee within UPNE, led by Dr. Afzal Sawal and Sadr Jafar Boy and Hisham Haq, etc., for example. And we will try and do some similar workshops across the UK, and Nottingham was just a start.
No, good, excellent. No, thank you so much for this description. And once again, I think it's a really good show going on, and you guys are actually taking time out on your holiday time, and especially on the weekend, it's really sometimes difficult. And as a medics, I can understand, but I think it's excellent effort from all of you, and Dr. Shahid Lateef as well. And Dr. Shabi, I think you explained everything very clearly about the stones and the role of visiting in the Ramadan and everything. So, Jazakallah khair, you guys are doing an excellent job. So well done.
Thank you, Dr. Heather. Very kind of you to call in after your lovely words. Thank you. Thank you very much. Jazakallah. Assalamu alaikum. Okay, right. Thank you. That's very complimentary and some very, very relevant questions. Thank you, Sarmad Mansoor, for joining us on Ramadan FM on our live stream. Shabi, just before we've got about a little below 2 minutes, but I don't want to go without talking a little bit about diabetes and kidneys, etc. So quickly, within I think about a minute, what would you like to say about kidneys and diabetes?
Especially with regards to the Asian population, the prevalence of diabetes is about 4 times more in the Asian population, especially in the 40 plus population. The type 2 diabetes, which is a non-insulin dependent diabetes, is extremely high in the Asian population, especially in places like Bradford and Birmingham and Leicester, where we've got big Asian populations. This is an epidemic. And the problem with diabetes and kidney diseases is that if diabetes is not taken care of properly, and if the diabetes controls are not appropriate, the kidneys can be killed or completely die off in less than 3 to 5 years. And we've seen numerous amount of people in their mid-40s, early 50s with end-stage renal disease secondary to diabetes, mostly from the Asian population. And if we are not looking after ourselves properly with our lifestyles, with our eating habits, with our medications, then we are sitting on a potential time bomb. So be very careful about it.
Very, very important. Thank you, Shabi. Thank you for that. We've touched on really, really important topics, and I want to say thank you very much to both Dr. Shabi Ahmed and Dr. Amir Birni for coming and taking out the time on a Sunday morning or going into afternoon, but it's still fasting, families, etc. You've been listening to Ramadan Special on EAVA FM 102.5 FM. I've been your host, Dr. Shahid Latif. We've had another wonderful job with two experts, and we will see you again next week. Look after yourself. Have a good week. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters, I just want to say a big jazakallahu khairah for all of you who have donated to help me build